Coronavirus is a disease that attacks the respiratory system. The symptoms of COVID-19 are fever, tiredness, dry cough, shortness of breath, headache, sore throat. Coronavirus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. Please don't be scared. To prevent infection and to slow transmission of COVID-19, follow the safety precautionary measures placed by the World Health Organization. Wash your hands regularly with soap and water, or clean them with alcohol-based hand rubs. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and stay away from large group of people. Please don't be scared of the virus. Follow the precautionary measures. Stay home, stay safe.
The first national situation report since the confirmation of the first case of the novel coronavirus disease in the Gambia on the 17th of March 2020, when the country reported the first COVID-19 case. So 5 new positive cases of COVID-19 have been reported, one of the highest number of cases confirmed in a single day. Of these, 1 case was reported from Central River region, and this is the first confirmed case from that region. While 1 is epidemiologically linked to the 12th case, 3 were close contacts of the 11th case. All confirmed cases have been in quarantine and are now moved to the treatment center. Only 1 of the confirmed cases is symptomatic. Out of the 28 test results received, 5 were positive for COVID-19, 2 were probable cases, and 21 were negative. Both probable cases are also linked to the 12th case. While no new person was taken into quarantine, 2 were discharged after testing negative for COVID-19 upon completion of their quarantine period. 101 low-risk contacts are being regularly followed up to ascertain manifestation of symptoms of COVID-19. The country currently has 72 persons under quarantine, 7 active cases, and 2 probable cases. A total of 555 tests were conducted and 17 are positive. 316 people completed quarantine, 690 contacts traced, and 310 people completed follow-ups. Globally, since the 31st December 2019 and as of 1st May 2020, a total of 3,400,323 cases of COVID-19 have been reported. Of these, 239,570 deaths were registered, and 1,081,162 recovered from the disease. Senegal so far have recorded 1,024 confirmed cases, 356 recoveries, and 9 deaths. So The daily coordination meetings are ongoing at both the strategic and technical levels. On logistics and safety, donated items for COVID-19 are being received and distribution is ongoing. The Operation Center Safety and Security Team are working with the National Security Task Force on the need for the implementation of stricter social distancing, border control, and the crackdown of people's smuggling schemes into the country at sea and land entry points. On surveillance and laboratory, out of the 28 new laboratory test results received, 5 tested positive for COVID-19, 2 were probable, and 21 were negative. Both probable cases will be resampled and tested in 2 to 3 days to conclusively determine their status. On case management, 7 COVID-19 patients currently are isolated at the treatment facility. 10 sets of dignity kits supplied to COVID-19 cases at the treatment center, and plans are afoot to supply the quarantine facilities. On risk communication and community engagement, 6 TV and 11 radio programs successfully conducted, 1 press briefing also conducted, 21 communities and 872 households sensitized or engaged on COVID-19 preventive measures using existing community structures. The summary of the social media activities include 2 Facebook and 2 Twitter posts shared with a cumulative engagement of 15,436 people. Summary of calls made to 1025. A total of 368 calls received. 351 are COVID-19 related and 17 non-COVID-19 related. 5 booked for further follow-up by contact tracing teams and 8 booked for further follow-up by the quarantine team. Regarding the next steps, the Minister of Health will embark on the following: to ensure there is a synchronized cross-border surveillance system with Senegal, inclusion of immigration in the rapid response teams to address the issue of non-Gambians sneaking into the country, RRT to vigorously and systematically investigate and establish the possible source of infections of the new cases, conduct thorough contact tracing in the North Bank East Health Region in order to track all possible contacts of the recent case who came into the country through Farafenya. Follow up with the Supreme Islamic Council on the domestication process of safe Ramadan guidelines on COVID-19 preventive measures. Strengthen surveillance at all points of entry, including the undesignated ones. Voluntary testing of all patients with respiratory symptoms at all health facilities. Engage private pharmacies to report clients presenting flu-like symptoms to the RRTs. Finalize SOPs on community engagement and social mobilization for social and behavioral change approaches on COVID-19. Minister of Health and the RCCE committee to work with municipalities on the community engagement. Strengthen RRT and contact tracing teams at all regions. Establish isolation centers in all major health facilities and hospitals. Deploy newly hired health personnel to their duty stations, and also enforcement of the letter and spirit of the restriction orders contained in the state of emergency declared. Finally, as COVID-19 cases are increasing, we would like to call on the general public to be more vigilant. COVID-19 is real, and we would like to urge the general public to strictly adhere to WHO and the Ministry of Health recommendations and guidelines on COVID-19 by desisting from public gatherings and practice social distancing. Specifically, we would like to remind corrected sales persons as one-tier, shopkeepers, salons, barber shops, tailors, and general merchant dealers that the state of public emergency regulations on their business operations remain valid and will be enforced by the local government authorities and security personnel. We would like to thank the general public for increasingly using the toll-free line 1025 to report suspects, and they can continue providing valuable information to the call center. Additional helplines available include 900-1025, 622-1025, 341-1025, 344-1025, 754-1025, and 210-1025. Thank you very much, and together we can defeat COVID-19 in the Gambia.
Thank you very much, Dr. Peter, for that elaborate update. Ladies and gentlemen of the COVID-19 Media Corps, the floor is open for questions, both in English and local languages, as you deem convenient. Yeah.
Yeah. Dr. Lima don laajte Abdoulaye Mendy Teranga FM. Lima don laajte mooy new cases yi dégg ni muy 5 cases yi dégg nañ ne bokk nañ ci ñi nga xam ne ñoo jëflante ak diamond ak 12 cases bi ñu amoon ci ginnaaw ndax loolu rek mu ngi wane tam community transfer bi ñu doon ragal démb ba tey boobu mu ngi on oo ba tey amul dara lu ci feeñagul fu ñu nekk nii loolu benn ñaareeli question bi tam ci mbiru press briefing bi previous mu ngi mel ni press briefing bi buñ ko ootee ñun balaa ñoo agsi liñ fi dee ut si dañ ko dee jot balaa ñoo agsi fii muy maanaam dinañ dee dégga yenn ci ay big information with regards to the press te at the end of the day daf dee tali ñoo nekk benn ndax lii tam du nasaxal liggéey bi ngeen nekk di def bu fekkee ne seen biir mu ngi am ay information yi nga xam ne dina dee lig laata ñu koy wax officiel yi for now foog naa yooyu laa amagul li ma bëgg a laajte.
Si laajte bi comme cases yu ñu am ñeneenti ni leen leen mun a boole aw ne leen mun a suñu leen seetee bu baax comme ñettey dinañ ko mun a wax ne bokk naa case 11 because soo demee into detail nga seet ko daanaka benn famille bi la doom ak wife ay yooyu noonu so ñu gën a jegeñ si taar case bi case 12 tamit kenn ki moom tamit dafa connecté ak case 12 bu ñu seetee bu baax waaye yeneen ñaari tamit yu nekk inconclusive they are connected to case 12 so loolu moo wane mooy waaw community transmission bi mu ngi am waaye suñ seetee ñu ngi def moo gëstu pour seet soo seetee case 11 bi case 12 bi raada ñu ngi doon jaaxle comme fan lañ ko war a jëlee waaye bu ñoo si gëstu bu ñoo def dafa noonu loolu mu ngi set waaye dina gën a set si kanam because gis neen benn contact bu nga xam ne moom contact am na te mu ngi positif te kooku mu ngi woon travel woon na ba ñëwaat so ñu ngi teel a gëstu ndax mun naa am foofu la ko jëlee pour ñu xam source because dafa important ñu xam source bi waaw so moo tax ñëpp léegi li ñu wax mooy ñëpp dañu war a jàpp ne ku nekk mu ngi am coronavirus pour nga mun a protect sa bopp so ñun ñëpp dañu war di sol mask def social distancing because léegi yow da nga seet sa bopp rek ne yow yaa amul képp keneen am na so léegi community transmission loolu la miin ne noonu lañu ko war a def affaire yi leak information bi concern la problème la pour ñun parce que ñun dañ jël liggéey si liggéey bu nga xam ne dañ confidential as health workers we are very confidential waaye léegi technology bi dafa dem bi nga xam ne kenn xamul fu moo jógee ndax si nit la ndax nit a ko capture ay waaye ñu ngi koo seet bu baax pour seet fan la lii dee jógee parce que daf dee dina disturb liggéey bi tuuti you know because looy ñëw wax si ñeneen ñi suñ ko jëlee dem yokka fa wala wàññi fa dafa tax ñeneen ñi léegi yow soo waxee sax ñoom bële leenoo gën a gom parce que am na tuuti dëgga bu fa nekka te mun neen see rax lu bari so loolu mun naa yokka problème waaye su nekkoon si dëgga bi rek leenoo am du nekk problème waaye comme su nekkee ne dañ si yokk dara wàññi ak yooyu so lu gën mooy still nit ñu jël official statement bi from Ministry of Health Facebook page or Twitter or ñu jokkoo ñun ñu wax leen ñu feel.
Thank you, doctor. Any additional questions? So countdown 4, 3, 2 before I close. Okay, go ahead.
Sorry, in lafta men yini gala fana wolong ni press briefing men kake watu wats kunungo ngamwele ko sinya follow Gambia bango kan jere ko nyin jangaro be sauna molni moltema melialo ko imanta imana nigumu tamalande fo bi fana nga kudo fana mo memu molulul tinme yalo ko wol fana yini kuron soto ando wol fana ya soto nyamen fana akeso man soto follow ka foko ya soto dulakai yin fana fo yin dum tati nala molbe ye hakilo ye jahase ka foko de kuran yin jannin jata kende ya bunda pol ba lon na mo jato kono wo ya tara wajabi ta banko kan already de tembo men ko
So namarika ko mama sene ya bale but ba katala demande so comme o ka fo nyame so sa un problème atata fo yalon ko sa amanke jorom mul mi yalon ko tamatale o mi contact soto ni mul mi yalon ko ya soto so mul mi yalon ko sita jan imanta dula funum also maje ko comme ayat ateni mul ya kafoke fo o ye contact ko soto so wala tinan ko sign community transmission bije so sign mol munyen no munakela ko ka de niti den wara try ka kata bake pour ka jeko social distance be ke kan anin fanan mo yeje ya muta ko mol be ya soto ya corona soto ite ma soto so ye tankani ngo ke ya try pour ya lon ko ite man nyin kurango soto inshallah.
Barkabake doctor, Manika on Senegal.
Yes, I just wanted to make an appeal.
Okay.
If we can get like a bit of the briefing in Wolof for the Wolof news, a summary of the briefing, if possible.
So luñ doon wax ci angale rek mooy fu mu toll nii am neen juróomi case yu ees ñu nga xam ne ñoom ñëpp dañ leen confirm ne am neen feebar bi ba pare am na ñaar ñu nga xam ne setut bu baax ñi nga xam ne leen seetaat bu baax ne fu mu toll nii ndax am nañ ko ndax amuñ ko laab bi loolu la mu wane fu mu toll nii si fajeekaay bi juróom-ñaari nit ñu ngi fa ñu nga xam ne ñu ngi leen a toppatoo fu mu nekk nii te ñu ngi feebar si juróom yu ñu am nii ñetta yi suñu leen seetee bu baax amoon neen contact ak bu nekk fukk ak benn bi kenn moom te amoon na ak contact ak bu mujjee bi waaye keneen si seen biir nag ku ko juróomeel moom mu ngi jógee CRR bi mooy njëlbeeni yoon ñu ngi am ku am feebar bi bu jógee CRR so waaye ñoom ñëpp lu si baax mooy ñëpp dafa tombé woon ñu ngi si suñ quarantine center yi nekkuñu woon si community bi yéegoon nañ leen ba ñu leen yóbbu woon si quarantine bi so bu ñu leen tesee ñu positif yomba na torop pour ñu yóbbu leen si fajeekaay bi so si gàttal loolu rek la na moom.
Does it count down? No more questions? Thank you very much, Doctor. We've come to the end of today's update. And just to remind everyone, as Doctor said, we just want to again appeal to all the corridor sale people. I know it is wanted season and Pugajai season, shopkeepers, saloon, barbers. Please remember that the state of public emergency regulations on your business operations remain valid. And don't be surprised if the security officers and the local government authority come knocking when the law is not followed. And as we know, the cases are increasing and we have to be more vigilant. And thank you very much, Doctor, for that explanation in English, Mandinka and Wolof. Thank you very much, Director Modunjai, and thanks everyone. We hope to see you on Monday. If you see you tomorrow, know that we have another kids. Thank you very much.
Then maybe not see tomorrow.